Hello friends, I am Dr. Sunnil Sainii, trauma laser surgeon, expert in limb lengthening, deformity correction, pain management, ozone therapy and biological methods of fracture fixations. Now today we are going to do EBOO, that is extracorporeal blood oxygenation ozonization. People say that it's like a dialysis, but it's not a dialysis because dialysis के अंदर हमें एक फिल्टर यूज करना पड़ता है. यहाँ पे इट इज नॉट विद फिल्टर एंड ये वर्ल्ड का पहला ईबू सिस्टम है जहाँ पे विदाउट फिल्टर यूज किया. तो थैंक्स टू iOS एंड थैंक्स टू प्रकाश सर. सो मैं डेमोन्स्ट्रेट कर रहा हूँ चीज़ें कि क्या क्या हम इस्तेमाल करते हैं. ये थोड़ा सा वैसा लगता है कि कितनी सारी चीज़ें वो होगी, बट इट्स वेरी सिंपल मेथड वंस वी गेट. सो दे आर स्पेशल सेट्स बाय iOS. ये स्पेशल सेट होते हैं बाय iOS. सो दिस इज द रिसेंट मोस्ट एडवांस ईबू सेट और यहाँ पे एक एक स्टेप्स हम बताएंगे. इट्स वेरी सिंपल. This set only, and this will be used for recipient. And these are the special flask which will be used for diffusion purpose. These all are already pre-sterilized. ये सारे के सारे pre-sterilized होते हैं. So these are the EBOO flask. इसके ऊपर top up, top down, which will go up and which will go down in the UVBI set. Okay. So हमारा UVB set होता है. This is the flask. Now I am loading heparin. So 4 ml of heparin will to be injected in normal saline. Now I am putting 4 ml of heparin in this mix. इसमें छोड़ दिया. The basic EBOO set which we are going to apply on the patient. इसके अंदर मैंने बताया इसके अंदर 3 holes होते हैं. In one hole this will go, in one hole the ozone will be there, and a third hole, smaller hole, the waste will come out. Now we'll set everything and then we will show you. So now I have connected the infusion ozone and the waste pipe, and I have checked my infusion pump. I have checked my infusion pump and I have set the infusion pump at 8. I have checked the rotation also. I have set at the 8. Now we are almost ready. Our donor vein is also ready. Now we will just go for the procedure. So we are all set now. We are just starting and we have fixed it at 10. इसको connect करेंगे. ऐसे रिलैक्स. कोई भी दर्द वगैरह टूनिकेट टाइट कर दो. टूनिकेट टाइट कर दो. कोई भी दर्द वगैरह लगे तो जस्ट बताना है. We are just starting now. Now you can see that blood is coming. This will go to this one. Now I have set it at 8. So initially whatever is in the tube priming जो हमने कही थी, that will come here. This blood is getting ozonized and now we have increased the rate of perfusion also. We have increased the rate. Now it is getting ozonized and you can see the cherry red color. You can see the cherry red color, and once the bottle is half filled, we will start our diffusion. We will start it on the recipient vein also. And we have started the UVBI, ultraviolet blood irradiation, and now we will start the recipient vein also. Okay, done. Ready? Prime कर दिया, अब इसको लगा दो. So now you can see blood is also going. Now we need to match the rate. We need to match the rate. Now here you can see the difference. You can see the difference. You can see the difference. The perfusion rate and this we have matched so that same amount of blood which is coming, same amount of blood is getting ozonized and going to the patient. The patient is totally comfortable, healthy young male. Now here you can see the difference in the ozonized. This is the blood which is coming from the donor site, and this is the blood which is getting ozonized and going back to the recipient site. And you can see here the difference. It is totally, there is a difference between the two. This is cherry red color and this is dark red. So this is how we do EBOO, that is extracorporeal blood oxygenation and ozonization. Advantage of EBOO is that we can give a higher dose of ozone. Unlike MAST, that is major ozone therapy, if we go for multipass in that, we can give it 5 to 10 times. Like we can take 50 ml of blood and we can repeat it 2, 3, 4, 5 times. iOS is the only organization in which we have now we are giving multi-pass by MAST also. But EBOO has very higher advantage because higher amount of dose can be given. All the indication of ozone autoimmunotherapy which we have discussed earlier are the indication which can be given, are the indication for EBOO also. So if like any viral infections, any type of rheumatoid arthritis, any inflammatory conditions like rheumatoid arthritis, even diabetic neuropathies, for general well-being, even patients who are suffering from chronic disease like chronic kidney disease, even in antiviral, it can act as antiparasitic, antibacterial. In all these conditions, EBOO can be very well used. Even in neuritis, it can be used. Even in disease like sclerosis, it can be used. Multiple sclerosis, it can be used. So there are numerous indications, not only musculoskeletal condition, not only for musculoskeletal conditions. Like in musculoskeletal, we are giving it for AVN, for rheumatoid arthritis, for even diabetic neuropathies, even we are giving it for ankylosing spondylitis. Other than that, various medical conditions in which it can be covered, and not only the medical condition, it can also be taken for general well-being, for performance enhancement, anti-aging. All these things can be taken as far as EBOO is concerned. So if you are interested to go for EBOO, you can contact the below number. Thank you so much.